MSc in Physiotherapy pre-registration is a science-based course, really focused around looking at the prevention, the management and the long-term management of people with illness, injury, disability and dysfunction. So we use simulation across the programme. We define simulation as not specifically defined by a technology, but a technique with which to mimic real life situations, whether that be clinical encounters with a patient or whether that be multidisciplinary team handovers or leadership simulations. We use what we call mixed modality simulation, so we use a mixture of our simulated mannequins, real life actors who may simulate a clinical patient, and we also are beginning to use virtual simulation to allow students to rehearse and repeat some of the learning that they may have done during their practical simulated sessions.
We have a number of placement opportunities. That includes the NHS, the private sector, and of real note, we are able to offer on-site opportunity for placements within our new integrated rehabilitation centre,
where we are expanding the opportunity for our students to be integrated within those rehabilitation services, looking at expanding our placement opportunity within the IRC, and also the opportunity to have access and exposure to those expert practitioners within the IRC.
So a standout memory for me would be my time on placement in the IRC. I got some really valuable experience. So I got to see neuro cases, MSK cases, and then also I had the chance to kind of work with exercise prescription as well, which is pretty unique placement because I don't think there was any other placement that had that kind of wide variety of experience.
I think it's becoming more recognised the role that physios play in terms of the services that are offered by the NHS. So we're sending out students on placement to in-hospital settings, whether that's respiratory wards, older people's wards, as well as outpatient settings, so seeing somebody in a musculoskeletal outpatient service, but then also into the community. And it's actually a real privilege to treat somebody in their own home. You get a real insight into kind of where they're at and what their level of need is. In terms of our students out on placement, they are highly regarded by our local placement providers, particularly studying at master's level, and with many of our students having a significant amount of clinical and therapy experience behind them before they're starting their physiotherapy course. So that has helped us to open up placement offers and be broad in terms of the placement experiences that we can provide.
One of the unique opportunities that you will have here at the university is the interdisciplinary learning opportunity.
Working with different types of courses, so there's been OT, so occupational therapists, there's been speech and language therapists on site, and there's also been dietetics. So working with those, and especially in our person-centred practice module, working with different types of clinicians, which has been really great.
What we are looking to explore is the ability for you to have shared modules, shared learning opportunities, and using problem-based learning for you to work alongside each other to understand and also engage with how you would collectively manage a patient.
So what inspired me to study physio was the fact that I can sort of help my patients, but in a very holistic and active way. So lots of that rehab, exercise prescription stuff I was really interested in. However, as I've actually gone through the course and been on a few placements, I've started to find other things that I really love as well.
So a great element to the course is two specific units, which are mental health and patient-centred care. And I think these are really essential and important skills for personalised patient care today. So those are the two elements which I think really makes the course at HSU stand out from others.